Most people believe that when a doctor says you need surgery, it must be the right decision. That acting quickly gives you the best chance to recover. I used to believe that too. Until after more than 20 years in the operating room, I started to notice something that changed the way I see every surgical recommendation. Not every operation makes a patient better. Some people walk into the hospital hoping to be healed and walk out with a body that no longer feels like their own. And what is even more concerning is this. Very few of them were fully prepared for that possibility before they agreed to the procedure. My name is Dr. Javier Morales. I am a cardiothoracic surgeon, and over the years I have seen both sides of surgery. I have seen it save lives in ways that still amaze me, but I have also seen procedures that looked successful on paper and still left a patient weaker, slower, more confused, or less independent than before. That is the part most families never hear enough about. As the body gets older, it does not respond to stress the same way it once did. The heart has to work harder under anesthesia. The lungs take longer to recover. The kidneys process medications more slowly. And sometimes the brain struggles in ways that can last far longer than anyone expected. This is why age is never just a number in the operating room. What matters is not only whether a surgeon can complete the procedure. What matters is whether the body still has enough strength to make it through the recovery that follows. Because surviving surgery and recovering from surgery are not the same thing. And if you are over 60 or caring for someone who is that difference matters far more than most people realize. Today I want to walk you through 7 surgeries that deserve a second look before you say yes. Surgery number 1 is something I see recommended all the time, especially for people in their 60s and 70s. Joint replacement. Most patients don't hesitate when they hear about it. The pain has been there for years. Walking is harder. Stairs feel like a challenge. And the idea of replacing a worn-out joint with a new one sounds like a second chance at life. And sometimes it truly is. But here is what often does not get discussed clearly enough. The success of that surgery depends just as much on the condition of the body going into it as it does on the procedure itself. Because when someone is already dealing with multiple health issues, heart disease, diabetes, poor circulation recovery becomes a very different story. After surgery, the risk of blood clots increases. Staying in bed too long can lead to lung complications. Even a minor infection can become something much more serious. I have seen patients who expected to be back on their feet within weeks only to spend months trying to regain basic mobility, not because the surgery failed, but because the body simply did not have the strength to recover the way everyone hoped. And that leads to a question most people never think to ask. Not just, can this surgery be done? But is this the right time for my body to go through it? Because with joint replacement, timing can matter just as much as the surgery itself. Surgery number 2 is one that surprises many people when I talk about it. Spinal fusion. Back pain is almost universal as we get older. I cannot think of a single patient over 70 who has not mentioned it at some point. And when the pain becomes constant, the idea of fixing it surgically can feel like the only real option. Stabilize the spine, relieve the pressure, solve the problem. At least that is how it is often presented. But the reality is more complicated, especially in older adults. The spine is not just one structure, it is a connected system. When one segment is fused and no longer moves the segments above and below, it has to take on more stress. Over time, that added strain can lead to new degeneration in areas that were not the original problem. And here is the part that many patients are not told clearly enough. For chronic back pain in older individuals, complex spinal surgery does not always provide better long-term relief than non-surgical treatments like physical therapy or targeted injections. I remember a colleague once telling me something that has stayed with me ever since. Sometimes the best surgery is the one you choose not to do. That does not mean spinal fusion is never necessary. In certain situations, it absolutely is. But when the goal is pain relief, especially later in life, it is worth asking whether there is a safer path that can achieve the same result. Surgery number 3 is one that almost nobody expects to hear on a list like this. Eye surgery. Most people think of it as simple routine, almost risk-free. And in many cases, it is. Procedures like cataract surgery are among the most commonly performed in the world, and for a healthy patient, the outcomes are often excellent. But what gets overlooked is how quickly the situation can change when the patient is older and already dealing with other health issues, because even a small procedure is still a form of stress on the body. I have seen patients go into what was described as a minor eye procedure and come out dealing with complications that were never fully explained beforehand. Infections delayed, healing inflammation that takes much longer to settle, and in rare cases, even a decline in vision instead of an improvement. The problem is not the procedure itself. The problem is the assumption that small always means safe. In reality, the body does not measure risk the same way we do. It responds based on its overall condition, and when that condition is already fragile, even something considered routine can become much harder to recover from. That is why it is so important to look beyond the procedure and ask a deeper question. Not just how simple it is, but how well the body is prepared to handle it. Surgery number 4 is where things become much more serious. Open heart surgery. When patients hear that their arteries are blocked, the solution often sounds straightforward. Bypass the blockage, restore blood flow, fix the problem. And for the right patient, that can be life-saving. But what many people do not fully understand is what the body has to go through during that operation. In open heart surgery, the heart is stopped. A machine takes over the work of both the heart and the lungs while the surgeon operates. For a younger, healthy body, this is something it can often tolerate. But in an older patient, especially one with existing conditions, this becomes an enormous stress on every organ at once. The heart has to restart. The lungs have to recover. The kidneys have to process everything that was introduced during the procedure, and the brain in some cases can take much longer to return to normal. I have seen patients who made it through the surgery itself, but struggled in the weeks and months that followed in ways they never expected. And this is where one simple question can change everything. Is there a less invasive option available? Because in many cases today, there are alternatives that do not require stopping the heart or opening the chest. And for the right patient, those options can make a significant difference in how well they recover. Surgery number 5 is one of the hardest conversations I have with patients: cancer surgery. The moment people hear the word cancer, the instinct is immediate: remove it. Cut it out as quickly as possible. Do whatever it takes. And that reaction is completely understandable. Anyone in that position would feel the same way. But over the years, I have learned that this is where the decision becomes much more complex, especially in older patients, because the goal is not just to remove the tumor. The goal is to give the patient more good years of life. And sometimes those two things do not align. There are procedures in cancer treatment that are incredibly demanding on the body. Surgeries that last for many hours that involve removing and reconstructing multiple parts of the digestive system. On paper, they can be successful. The tumor is gone. The margins are clear. But I have seen cases where the patient never truly recovers from the operation itself. The body is simply too overwhelmed. Complications begin to stack up: infections, organ stress, prolonged weakness. And instead of gaining time, the patient loses the ability to live the time they have in a meaningful way. This is what makes the conversation so important. Not just can we remove the cancer, but what will life look like afterward? Because in some situations, less aggressive approaches like targeted therapy, radiation, or careful monitoring may offer a better balance between longevity and quality of life. Surgery number 6 is something that often feels much less urgent, but still carries real risk: elective abdominal surgery. This includes procedures like gallbladder removal or other operations that are scheduled in advance, not emergencies. Many patients choose to go ahead with them for peace of mind. Fix the issue, now avoid problems later. And sometimes that is the right decision, but not always right away. I have seen patients rush into these procedures simply because they were told it would be easier to deal with it sooner rather than later. What they were not told clearly enough is that in many cases, these conditions can be monitored, managed, or treated without immediate surgery. And when the body is already dealing with multiple health challenges, even a planned operation can carry significant strain. Infections, slower healing, stress on the organs, these risks may not seem dramatic at first, but they can change the entire recovery process, which is why timing matters here as well. Taking the time to strengthen the body, to stabilize existing conditions, or even to explore non-surgical options can make a meaningful difference, because sometimes the safest decision is not to avoid surgery completely, but to choose the right moment for it. Surgery number 7 is different from all the others because this is not something you plan. It is something that happens to you. Emergency abdominal surgery. This is the kind of situation no one really prepares for. A sudden blockage, internal, bleeding, a ruptured organ. One moment, everything feels manageable, and the next, there is no time to think. Decisions are made quickly, often in a hospital corridor, under pressure, with very little information, and this is where the risk becomes the highest. Not because the surgeons are unskilled, but because the body is already under extreme stress before the operation even begins. In older patients, especially those over 75, the body is not just dealing with the surgery. It is dealing with shock, inflammation, and multiple systems being pushed at the same time. The heart, the lungs, the kidneys, they are all trying to keep up, and sometimes they cannot. I have seen situations where the surgery itself goes as planned, but the recovery becomes a completely different battle. The body struggles to stabilize. Complications appear one after another, and what started as an urgent attempt to save a life turns into a much longer and more uncertain fight. That is why, even though you cannot control when an emergency happens, there are still 2 things that can make a real difference. The first is not ignoring early warning signs. Persistent abdominal pain, unusual bloating, changes in digestion. These are things many people brush off, but catching a problem early can mean treating it before it becomes an emergency. The second is something most families avoid talking about. What would you want if a situation like this happened? Because when time is limited, those decisions often fall to the people standing beside you. And having that conversation ahead of time can make one of the hardest moments a little clearer. Now, before any surgery, whether it is planned or unexpected, there are a few questions that can completely change the way you make a decision. One of the most important is simply this: what happens if I do nothing for now? Another is whether there is a less invasive option available, something that puts less strain on the body while still addressing the problem. It is also worth asking what recovery actually looks like for someone in your specific condition, not the average patient, but you. And finally, a question that many people hesitate to ask: what is the real complication rate for someone like me? Because the answers to those questions often reveal more than the recommendation itself. I want to tell you about a patient I will never forget. I will call him Robert. He was 72 years old, a retired engineer, thoughtful and careful with every decision he made. By the time he came to see me, he had already spoken with 3 different surgeons, and all of them had given him the same recommendation: open heart surgery. But what stayed with him was not fear of the operation itself. It was something he had seen before. 2 years earlier, his wife had gone through a major surgery. The procedure was considered successful. Everything had gone according to plan. But when she came home, she was not the same person anymore. He told me she walked into that hospital as my partner, and she came out as someone I had to take care of. That was the question behind his eyes when he sat across from me. So we slowed everything down. We talked through his condition, not just the blockage in his arteries, but his overall health, his energy, his daily life, what mattered most to him. And then we talked about options. Not just surgery, but a non-surgical approach that could offer a similar outcome over time. He went home, thought about it carefully, and made a decision that felt right for him. He chose not to have the surgery. 4 years later, I received a photo from him. He was standing on a hiking trail with his 2 granddaughters, smiling in a way that told me he had made peace with that decision. And moments like that are why I believe something very strongly. A surgical recommendation is not a verdict, it is the beginning of a conversation. As a surgeon, my job is not just to operate, it is to help patients understand what they are stepping into, what they might gain, and what they might risk losing along the way. because sometimes the best decision is not the most aggressive one. It is the one that aligns with the life the patient actually wants to live. If you take one thing away from this, let it be this. You have the right to pause. You have the right to ask questions. And you have the right to choose what matters most to you. And if you know someone who may be facing a decision like this, share this with them. It might help them see their options more clearly. One last thing I want to say, and this is important. Everything I have shared here comes from clinical experience and general medical knowledge, but every person is different. Everybody responds differently. This story is not a rule, and it is not a recommendation for any specific individual. Before making any decision about surgery or treatment, please have a direct and honest conversation with your own doctor, someone who understands your full medical history and your personal situation, because that conversation, more than anything else, is where the right decision begins.